liquid should be used in creating clearance less than 25 or 0.5. Typically, we use the aliquots with those when people have this level for serum creating. Obedaxa, we should avoid when early, and it's not recommended to start in patient with clearance less than 50. Creating clearance at 60 or above is considered the normal renal function. When it's less than 60, it's not normal. And then when it's creating clearance below 50, it's not Obedaxa. I'm trying to with patients who have mechanical heart, hepatitis, schizophrenic patient. When people have the AST or LST, should be of their upper limits, aliquots or whatever. Pregnancy, people who are pregnant should avoid taking this medication. Aliquots, Obedaxa. The side effect is better in stomach bleed or GI bleed. Obedaxa is the GI side effect. So people who have stomach problem, peptic ulcer, and like that, they should avoid taking Obedaxa. Dosing, quick, and Obedaxa have similar dosing. They take they should be taken day. For the feeding, that is not recommended. The Obedaxa dosage form of capsules. So the capsules cannot be crushed or opened. Capsules may be stored. It must be capsules of the store in original containers, or when it's open, it's only when it's open and then it's over 3 months, the medication no longer have efficacy that it should. So if we open the container, then we should use these medication 3 months. Issue, we don't recommend people to use for some hospital. You used to have the bubble bag for like 90, and then this medication must store in the original container from the light, not in the bubble bag setup. Not have with the 3A4 drugs. Different. The Aliquix had a reversal agent is called the SL. The Badaxa root side. So they have different antidotes or reversal agents. So generally, it's less common Aliquix, but Badaxa those people with renal function, and they are otherwise Aliquix should be started in patients have the of stomach, a baptist ulcers, or bleeding, have function problem. The big advantage Badaxa, the Badaxa used in the bubble bag setup for the hospital. Yeah. The patient who need to bubble bags for all of their medication. All right, if you have any further question or concern, why we choose the Aliquix versus why we choose versus Aliquix, no those. Thank you. About so Abisiban versus Zero or so how do when how we know how to choose one of these medications. So first have stroke, non-valvular AFib, and thromboembolism, and DVT or PE. First, you look at choose this medication. Aliquix is better for impairment or renal people who do have no problems. So initiate Aliquix of Yeroto is over 80 years old. Aliquix, we need serum pH less than 25 or serum over 2. For these patients, significant renal function, we need you need to monitor we need to test kidney function to make sure patient. For people who during less than 25 or to reduce the dose to 2.5 twice a day of milligrams twice. For Yeroto, we should avoid patients creating clearance less than 30. So I just mentioned should not start Yeroto for patients over 80 years old who have some kidney function problem. This medication generally absolutely contraindicated in patients who have mechanical heart valves, active liver disease like active active hepatitis, cirrhosis, or significant LFT elevation. If the AST or the the AXT or the ALT over 2 to 3 times their upper limit, then you should not use this medication. People who are should this medication. For this, the more concerned effect is bleeding. So the Eliquis is better than Yeroto for the stomach or GI bleed. So people who have concern about they have some kind of stomach problems history, then we should start with the Eliquis versus the Yeroto. Dosing, the Yeroto might be advantage compared to Eliquis because Eliquis is taken every 12 hours a day. The Yeroto take once a day or every 24 hours. But it's must take with a full meal, full stomach. So there is one advantage of the Yeroto compared to the Eliquis because it's take once a day instead of twice a day. For people who have problem to remember taking the medication, then they might Yeroto if they don't have issue like bleeding risk or kidney problems. For some patients, they need to use the feeding tube, and probably the Eliquis is recommended. This medication, they have similar drug interaction. They should avoid the some inhibitors medication, like CYB 384 and PGP substrates. So CYB 384 inhibitor and PGB substrate. They have similar antidote or reversal agent. The andexanet alpha or andexa, the brand name. So generally, the Eliquis is recommended more than the Yeroto. Only a few or some patients want one daily dose, then they want to start with the yellow top. You let me know if you have any question on these two medications. Thank you. And about the Aliquid versus warfarin, so you will take Aliquid or Abicipar versus warfarin. When you go to Google and you just search for it, Aliquid versus warfarin, you will have about 600,000 results. And for first few one, you can find some good information why they choose Aliquid versus warfarin or vice versa. So the first one from myheart.net, shorter acting than, excuse me. So Aliquid is shorter acting than warfarin, and the blood thinner effect is quicker gain and loss after about 24 hours. Aliquid rarely require bridging because it is shorter acting and can be safely stopped a day or two before any medical procedure or surgery. Yeah, so it's Aliquid image and the warfarin image here. It's not always the case. It is just general information. I've been working for the Anticoagulation clinic for many years. So yes, Aliquid, you have to take one twice a day. Whereas the warfarin or Coumadin, you take one tablet, one dose a day. So it have a longer half-life, and it take a longer time to get to the peak effect and get into stable state. So usually warfarin take 3 to 5 days to start working in your body when you just start warfarin, and then you take 1 to 2 weeks to get to the peak. Like the peak, and then become a stable state after 2 weeks or so. Aliquid is just similar to the low-enough injection or enoxaparin injection. So Aliquid is the fifth dose medication. Either take 5 milligrams twice a day or 2.5 milligrams a day for certain patients. So it works every 12 hours medication. You should take same time every day, every 12 hours, and then the warfarin the same time every 24 hours. Aliquid is very expensive medication compared to warfarin. Aliquid, even though you have a copay, it is very expensive, like $500 per month, and about 1,000 or more for 90-day supply. Warfarin is like $10 for 3 months or so it's very cheap. Aliquid is a new medication. I think it's available in 2018 or so, 2017 till now. It's been studied, and it shows that the Aliquid is effective, just like warfarin. And for elderly people, it's they don't have to go with the confused dosage with warfarin. Aliquid just take the fifth dose twice a day. So it may be best for a lot of patients, especially elderly people. Warfarin is very complicated in dosing. You know, someday they take one tablet, someday they take half tablet. It's a weekly dose, yeah, but you have to take every day. It sounds very complicated. Another advantage of Eliquis is diet. You know, warfarin might be affected by the vitamin K foods like greens, vegetables like kale, cucumbers, spinach, broccoli, things like that. Might affect some. If you eat more vitamin K food, make the iron level go down. And if you eat less vegetable, it makes the iron level go up. So you must be stable with vitamin K foods every day. Eliquis is not effectively K foods, so you know most of people happy with that. They don't have to watch for their diet. And another advantage of Eliquis compared to warfarin, Eliquis doesn't require close monitoring. Okay, some people, if you are over 75 and you have normal kidney function, normal liver function, you only require to test your blood, every 6 months. And then for warfarin, you have the maximum they can extend the follow-up is 6 weeks. Okay, so 6 weeks you need to come back to get the iron test, your blood test, to make sure your warfarin level is not too high, not too low. When iron is too low, it means you don't have enough warfarin. When iron is too high, it means you have too much warfarin in your body. It's like heart bleeding. So that's why they have to test your iron level frequently. If you are stable, your iron are very stable, then you can come back in 6 weeks. But if your iron level is not stable, you have to come back frequently, like weekly or 2 weeks or 3 weeks, depending on your iron level. If your iron level is critical, it means it's too high, like 5.0 or 6. Then you might need to hold warfarin and come back in 3 days or 2 days, like that. But an Eliquis is not a frequent follow-up or test. No test required to make sure the Eliquis is enough in the body. No, we don't have that test. It's very expensive, and it's no why. For the side effect, somehow, and then for elderly patients, Eliquis may be better than warfarin because they don't confuse. They are not confused with the dosage. So if they take the Eliquis with the instructed dose, then they have no problem with the bleeding. But for warfarin, sometimes they confuse with the dose, and then they may take a wrong dose, and it will cause bleeding. That's one reason. The second, Eliquis may be better in terms of solvent bleeding to warfarin for the elderly patient. And then the Eliquis, like low enough protection, so before the surgery, because you may only need to hold for 2 days prior to the major surgery or procedure. But depend on the kidney function. If you had a bad kidney function, then you need to hold more than 2 days, like 3 or 4 days, depending on your kidney function, you know. And the allergists, they only need to monitor the side effect, which is they need to bleeding. So they need to test your complete blood count to make sure you know the hemoglobin is not. If the hemoglobin too low, you might have some kind of internal bleeding. Then you know you need to pay attention on allergies, and then you need to go to see a doctor, the stomach doctor, to make sure it's not caused by the allergies. And then you know you need to check your right when you're on blood thinner medication. You need to check your stool and your urine frequently to make sure any kind of bleeding. Check your skin to see if any abnormal bruising. Those things that you need to pay attention, and you need to avoid any physical activity that easily cause fall. So those things need to be careful when you're on any kind of blood thinner medication. So eloquence generally is maybe better than warfarin. It's perfect, and then it's more convenient than warfarin because you know the dose is a fixed dose and they're not required to test frequently, and they're not the diet, you know, vegetables, greens do not affect allergies. So more convenient is maybe better in terms of side effect for some people. The disadvantage is it's so expensive. Some insurance, some healthcare, sure they don't pay for it. So you need to work out with your health insurance to make sure they cover. And you know, if somebody worry about their therapeutic or their how the allergies work in their body, how do they want to know, you know, if enough allergies in the body or not. So if for some people like that, they may stick with warfarin. They don't want to try the medication. You know, it's not. It does not need the blood test to make sure it's not too low or too high, like warfarin. And some people need to take Eliquid with a lower dose, like 2.5 milligrams twice a day. Nobody's 80 years old and their weight is under 132 pounds, things like that. If they have those two factors, then they require to take a lower dose. If their kidney function, you know, if their creatinine lesser than greater than 2.5, then probably they need to take a lower dose. For certain people, like people on dialysis, they may be not the best candidate for the allergies. They should stick with warfarin. So, if you have any further question or concern about if you are taking any platinum medication, please let me know in the comment below. How to switch from Eroto to warfarin? You can go to Google again and type in switching from Eroto to warfarin. You have about 4,500,000 results. So that's a lot, but the first few result and learn how to speak to orphan from Yeroto. So they recommend that you need to continue Yeroto orphan. You start orphan and continue the Yeroto together, overlap for 3 days. So you stop the Yeroto in 3 days. Switching from Yeroto to warfarin. Okay. So you start warfarin and then Yeroto, and then stop the Yeroto in 3 days. Okay. So hopefully in 3 days warfarin start working. Okay. But if the in 3 days detect the I9 level is still too low, like 1.2, 1.3, 1.4, and I would continue Yeroto for 1 or 2 more days and increase the warfarin a little bit to make sure the patient is safe from blood clot. I sure that to tell the patient to remember to stop Yeroto as instructed. Some patients they forgot to stop the Yeroto. So that's the main thing. The patient or the patient make sure they stop the Yeroto as well as may cause bleeding. So I for the new warfarin start, you check the iron level maybe twice a week. Monday and then the next and first day of Friday. So I would recommend that you should, start warfarin and then stop the Yeroto in 3 days. And then we check the iron. If the iron is still too low, then I would recommend continue for another 1 or 2 days. Then adjust the warfarin dose to make sure it's not too high and not too low. And then recheck in about 3 days to make sure patient is not at risk of blood clot or stroke. And then to make sure the patient is not continue taking both medication, the Yeroto and warfarin. Okay. So if the iron is still very low, and probably need to increase the warfarin, get to therapeutic level, and have the patient for abnormal bruising or increased bleeding risk. Thank you. How to switch from warfarin to Badax? Go to Google and type in switching from warfarin to Badax. You have about 340,000 results. The first few top results, we may have some comments. Here, PHARMACIST.com give you a very quick information. So you start at Alexa when I less than 2. So this is general recommendation that how you apply if you are from the hospital setting. If you work in the hospital, you might check I9 less than 2, then you start by that on the same schedule, start the warfarin. And by that twice a day doses you take one capsule twice a day. How about the outpatient setting? Um, if you check the INR and INR is less than 2, and the patient has the outpatient clinic, and you are able to give the patient the medication, the Badaxa, then the patient can start Badaxa at the schedule of warfarin. Stop warfarin and start Badaxa. But when I'm at the therapeutic level, like between 2 and 3, so you have to wait, like hope for 1 day to make sure I'm less than 1 to 2 days to make sure I'm less than for the patient the Adaxa. But if the patient need to, if you need to send the medication to the patient home, if you overnight, it may take one day. And then if the INA is at the therapeutic level, then I need to go 1 or 2 days, make sure INA less for the patient. If the INA at the time of visit is like 3 above the level, 3.1 to 5, then probably the patient needs to go more than 2 days, like maybe 3 days. And how about if the INA, above 3.6 or so, then probably the patient needs to beg to reject INA, just hold one or a half dose or 1 dose to make sure that INA back to the normal range, and then recheck it for the notice or further instruction. Depend on the INA level and inpatient or outpatient status to provide best recommendation when doing from open medicine. How to switch from production to open, or from a bigger trend to open. So go to go, and I've been switching from production to open. You have about 400,000 folks. Again, look at the first few of websites right here. Stop offering and start the bigger trend when I'm less than over limit of therapeutic brand less than 2. PharmaCist.com recommend stop open and start the bigger trend when I'm not. So in the hospital setting, you can do daily INR. So you check the INR, it's less than 2, then just stop, open, and start the bigger trend. But how about the outpatient setting? At the time of business, when INR less than 2, then probably you can hold the bigger trend 1 day, and then but that's if the patient has the medication on hand, then you may when INR less than 2, stop open and start the Badaxa. If the patient don't have the Badaxa on hand, you need to overnight overnight medication, and like that, it may take 1 day or so to get to the patient home. So you need to, if the iron at the therapeutic level, then you just hold the bigger pen for 1 day or 2 days prior to the dioxide. If the iron like 3.2, 3.1 to 3.5, then I will hold open for like 3 days or so to make sure that I less than 2, then start the dioxide. But if it's greater than 3.6, I would hold the warfarin for 1 day and have the patient come back in 1 week to recheck the I-90 for further instruction. So it depends on the iron level in order to recommend how many days you need to hold the warfarin in order to get the iron analysis or switching to that. All right, so how do we switch from warfarin to Xarelto or rivaroxaban? This one is a little bit different. You can go to Google and type switching from warfarin to Xarelto or rivaroxaban. You have about more than 400,000 results. Okay? And for the first few ones, there is some information that tell you how to switch to Xarelto from warfarin. So right here they say from warfarin, stop warfarin and start Xarelto when I less than 3. You know that for the Eliquis or that's when I less than 2, but for Xarelto is that 3. Why? Why it's different? Because Xarelto is kind of little bit, it has a little bit longer half-life. So when it has longer half-life, and the medication lasts longer, and then it takes time to get to effect. So, when the iron is less than 3, you stop the warfarin and start Xarelto. It takes some time for Xarelto to work in your body. So that's why they want the iron less than 3 instead of less than. So, and then similar to Eliquis, if the patient had a life-threatening blood clot or having high risk of stroke, then you may need to consider the anticoagulant injection. When you want to switch from Xarelto to warfarin, and then you might need to consider the injection to make sure the patient don't have any stroke risk or any life-threatening blood clot. But when you switch from warfarin to Xarelto, then you only need to know when the iron is less than. But from the hospital and the outpatient patient. So in the hospital, you may monitor iron or recheck INA maybe daily basis to make sure INA less than 3 before you start the Yeroto. But how about the outpatient setting? You don't do the INA daily basis. How do you plan for that? For me, when the INA, for example, at the therapeutic INA, then yeah, I just tell the patient to stop the open, and I overnight the Yeroto. I send the patient to the pharmacy window so they can pick up the Yeroto and start the Yeroto next day, the same schedule they are taking warfarin. When I know the INA therapeutic, then it's between 2 and 3, then I'll say warfarin for the Yeroto tomorrow, and I know the patient will receive the medication at window, or you have the patient tomorrow the overnight service. How about if the INA too low? If it's too low, then I would just say warfarin at their schedule, and then start the Yeroto the next day at the sense of warfarin. If the INA too high, like 3.5 or 3.5 or 4, or or about 3. So if it is if the INA about 3.2, then I would just say stop the warfarin for 1 day, and then go ahead and take Yeroto the next day. But if it's 3.5, then I might recommend to stop warfarin for 2 days prior to take Yeroto. If it's 3.6 or above, like 4, and then stop the Yeroto for 2 to 3 days. But if it's more than 4, then I have to hold the dose, and I have the patient to come back, in 1 week, and to reset the INA and go from there. But I don't. If it's above 4, and I have the patient to reject. That's how I switch to Yeroto. So how you switch from Eliquis to warfarin? You can go to Google and type in switching from Eliquis to warfarin. You 300, more than 300,000 results from this. But the Top Fuels website have some very important information for you. The first one, say converting the Eliquis or this event. It recommend start warfarin and stop this event 3 days later. So this is, but this depends on the warfarin. For example, the baseline for warfarin, before you start warfarin, you need to get the baseline warfarin. Okay, and the normal warfarin is usually below 0.9 or 0.9. So around that level is no warfarin. The people never are. But how about if the warfarin level at that time at the baseline very high, like 0.2, I mean 1.2 or 1.3, like that, and you need to stop this event maybe days or so, and then the second option, they say maybe stop this event and start the parenteral anticoagulant or the injection anticoagulant. So, like Lovenox, and then warfarin at the same time. So, for some people, they are very high risk of stroke or um, of complicated situation. So you need to make sure that the patient not have any kind of life-threatening issue. So at that case, you might, if you want to switch to warfarin, and you probably need to make sure warfarin at a therapeutic level. In order to do that, because it takes about 3 to 5 days in order to make sure that I get to the into the therapeutic level. In order to make sure that you need to have some injection, like low injection, to make sure they having strong, dangerous blood clot. So that's what you need to know when you switching from aliquot to warfarin. But you need to make sure you have the baseline iodine, and then based on the iodine level, you may need to make sure when it's safe to stop the aliquots. Maybe 3 days later, if you have normal baseline iodine. If you have high baseline iodine, then you might need to consider to stop a little bit sooner. And then if you think that the patient is very high risk of having stroke or dangerous blood clot, then you need to make sure that you have some form of the injection, like low to the iodine level at therapeutic before you stop the low injection. Make sure the patient not having stroke or dangerous blood clot, like blood clotting. Thank you. How to switch from aliquot to warfarin? You can go to Google and type switching from aliquot to warfarin. You can find about 300,000 results for last search. Look at the first few results. The first result is telling you right here, say, converting aliquots or abicipene. So they recommend start warfarin and stop abicipene 3 days later. So basically, it depends on the warfarin level. For example, if I'm at the therapeutic level, yes, then you may stop. I'm sorry. If the iron as the baseline is normal, I mean, usually the normal iron is less than 0.9 or so. Is the people who never take the warfarin before. So you basically just start warfarin and stop abicipene 3 days later. But how about if the iron is higher than the normal level as the baseline? So you need to properly, start the warfarin and stop the abicipene maybe 2 days later to be safe bleeding risk. It's also said that if you need to make sure, for example, if the patient is very high risk of the blood clot, like acute blood clot, they just have the blood clot in their lung, and the blood clot is very critical, dangerous to the patient. The patient should not the INR should not be low, or the patient need to have certain anticoagulant in their body. So for that case, then the patient might need to take the warfarin and the injection, like Lovenox injection. So for that case, yeah, you need to start the Eliquis, and then start the warfarin and the Lovenox together. To start warfarin and Lovenox together from day one for maybe 5 days or more, and then check the INA to make sure the INA levels is at therapeutic, between 2 and 3 or so, and then stop the Lovenox injection and just continue to take a warfarin alone. So that's the case that you need to make sure that you how to switch from warfarin to Eliquis. So you can go to Google and type in switching from warfarin to Eliquis or apixaban. You can find about 400,000 results. But the first few websites help you to understanding how to switch from warfarin to Eliquis or other direct acting oral anticoagulations. So for Eliquis, we'll switch to the Eliquis when the INR are less than 2. So, excuse me. So, for example, if the patient INR is therapeutic at the Coumadin clinic visit, I used to have the patient stop taking warfarin about 2 days prior to starting the Eliquis. So, at that time I had time to send out the medication to the patient. For example, if I overnight, then the patient should receive the medication the following day. Or if the patient pick up the medication at the window at the pharmacy, then the patient have the medication ready to switch to the Eliquis from warfarin. So again, it depends on the INR level, so we can have the patient switch from warfarin to Eliquis from the outpatient setting. So if the patient is inpatient or hospitalized, then it's easy to stop the warfarin and try to retest the INR to make sure it's less than 2 before start taking the Eliquis. It's more easier for the patient to switch to the Eliquis when they're still at the hospital. But if the outpatient management, then you need to like stop the warfarin for 2 days. If the INR at the therapeutic level, and then start the Eliquis to make sure the INR less than 2. If the INR a little bit high, you know, like 3.2 or 3.3, then I would recommend to start the warfarin for 3 days prior to starting Eliquis. But what happens if the INR at the you know, really high, like 3.6 or above in the time visit, then I would recommend I would reduce the dose or take up a partial dose and then retest INR in 1 week to make sure INR level therapeutic before switching to the Eliquis. And when the INR at the therapeutic level, then just try to hold 1 or 2 days prior to the Eliquis, prior to starting the Eliquis to make sure the INR is. The COVID-19 caused VTE, the venous thromboembolism, the DVT or PE, thrombosis or embolism. You can go to Google, you can type COVID-19 caused VTE. It will show up, about 840,000 results. So the first few results indicate that the patient with the COVID-19 infection might experience an increased risk of venous thrombosis, DVT or PE. So. And then you can see the most popular website in the medical field is uptodate.com. It also shows that the COVID-19 patient might experience decoagulation disorder. And then in the following website, Boston Medical Journal.com is also show that the patient with the COVID-19 are associated with the venous thrombosis. So, yes, the answer is yes, the COVID-19 may cause the venous thrombosis. So, I have experienced some patients who have the COVID-19 vaccine and they experience the increase of the INR. So the COVID-19 vaccines might increase the INR number. It's not much. It's about between 0.5 to 1. For example, people who normally around 2.5, they may increase the INR to 3.0 to 3.5 after vaccination. But
but it not last long. Usually they experience the iron in weeks, and after that they back to the normal target, normal range. So those 3 to 4 weeks, the patient who have increased the iron due to the COVID-19 vaccines are used to reach the warfarin dose a little bit, like maybe just a half dose to make sure that I'm not outrange, not super therapeutic. So, so yes, some people have a concern whether or not the COVID-19 vaccine affect the iron level or not. Yes, they
avoid production or the bigger trend. If you are allergic to Badaxa, you should avoid Badaxa for some indication, such as anti-phospholipid antibody syndrome or mechanical heart valve. You should avoid Badaxa if you are taking rifampin, St. John's wort. If this medication may reduce Badaxa effect, you should avoid Badaxa in verapamil, quinidine, erythromycin, ibuprofen, ketoconazole. Might increase your Badaxa. You should check with your pharmacist or your doctor if you are taking any new medication or over the counter. You taking Badaxa, movement, or aspirin may increase risk of bleeding when you take it. So make sure you let your doctor or your pharmacist when you are taking Badaxa. You should avoid Badaxa if you have major and ongoing bleeding with Badaxa. You should not use Badaxa gloves due to anti-cancer. Typically, for people who have blood clot to cancer, they should take warfarin instead. You should check with your doctor who manages your blood medication or the anticoagulation clinic for further instruction. Please let me know if you have any questions in the comment box below. Thank you. Avoid erythritol or rivaroxaban if you are allergic to erythritol. You should not use erythritol for some indication such as anti-phospholipid antibody syndrome or mechanical heart valve. You should avoid rifampin, rifadin, carbamazepine, phenytoin, because this medication may reduce your erythritol effect. You should avoid erythritol if you are taking ketoconazole, ibuprofen, ritonavir, because this medication may increase. You should check with your doctor for for any other medication. There is no drug interactions between and prescribed medication or over-the-counter, Motrin or aspirin. You should avoid Xarelto if you are in major and ongoing bleeding with Xarelto. You should not use Xarelto if you have blood clots due to active cancer. This is just for your general information. You should check with your doctor or your pharmacist if you have any further questions. Please let me know if you have any questions in the comment box below. Thank you. Avoid Eliquis or ABC-band. If you are allergic to Eliquis, you should not Eliquis for indications such as for indication anti-phospholipid antibody syndrome, mechanical heart valve. Should not take Eliquis if you are taking rifampin, carbamazepine, phenytoin, because these medications may reduce the Eliquis. If you should avoid Eliquis if you are taking ketoconazole, ritonavir, because this medication may increase the Eliquis. If you have to take ketoconazole, itraconazole, or ritonavir, you may have to reduce the Eliquis. You should avoid Eliquis if you have major and ongoing bleeding with the Eliquis. You should not take the Eliquis if you for the blood clots due to active cancer. Generally, if you have active cancer, you may try warfarin or the instead. This is just for your general information. You should check with your doctor who manages your blood thinner medication, your anticoagulant for further instruction. If you have any questions, please let me know in the comment box below. Thank you. Heroin addiction. Addiction means you want to have the same feeling the opioid give you. Opioid give you a good feeling like high, so you continue having that feeling. It means addiction. Heroin is an illegal opioid, such as cocaine. Other non-opioid drugs such as marijuana, methaqualone. Marijuana might be legal in some states for medical treatment. And prescription opioids, including OxyContin or oxycodone, fentanyl. Methamphetamine is non-opioid. It is stimulant. A lot of people start using heroin after they have hard time to get the OxyContin due to the OxyContin issue to the manufacturer who do A lot of people will die because of the OxyContin long extended relief effects overdose. The manufacturers had to find a now it renamed as Pharma. So when the OxyContin supply has problems, the drug cartels take some advantage about that. They start produce the illegal drug, the heroin. The people who have the OxyContin abuse, addiction, dependence, they are looking for a alternate drugs. They are start using heroin. They are start using heroin because this illegal drug is cheaper, but it's equivalent or stronger effects. Heroin dependence or addiction can be physical or psychic. People who have heroin addiction or dependence tend to be overdosed because they want to have the same feeling. In order to get the same feeling, they need to continue to use this drug. When they don't have money to buy the drug, they will commit crimes. You should seek a medical treatment if you think drug or opioid dependence or addiction. Fentanyl addiction. Fentanyl is the hard topic right now because many illegal migrants enter with the fentanyl products. So fentanyl, we have illegal opioids and illegal opioids, including non-opioid illegal drugs. Marijuana, methaqualone may be legal in some states. And the prescription opioids, including OxyContin or oxycodone. Fentanyl is a synthetic opioid. And non-opioid methamphetamine. Methamphetamine is a stimulant. The prescription opioids, including OxyContin, fentanyl, due to treat a severe pain. How it works? Fentanyl might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just not a disease. For example, arthritis is a disease that might cause a pain symptom. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, research Soma before an opioid or a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Fentanyl is being manufactured a lot nowadays from China, and then it gets into the United States via the Mexico border. People who have the heroin or OxyContin addiction or dependence, they start using the fentanyl. Maybe more convenient and it might be cheaper or stronger effects. The OxyContin supply had some issue because there are ongoing lawsuits to its manufacturer, Purdue Pharma. The Purdue Pharma had to file a bankruptcy. Prescription dose for medical treatment, the fentanyl batches from 25 to 100 microgram per hour. Fentanyl 25 microgram per hour equal to OxyContin 10 milligram every 12 hours. Fentanyl is 3 times more potent than heroin and 1 potent than morphine per DEA. So per DEA, the lethal dose is about 2 milligrams or 2,000 micrograms. Many tablets or pills from these illegal migrants found more than 2 milligrams. So one tablet contains more than 2 milligrams. It's enough to kill a person who took that tablet or pill. The fentanyl dependence or addictions can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. Opioid effect, they give you a good feeling, like high, so you continue having that feeling. It means addiction. It's easy to get overdosed because you want to feel better and better with that feeling. At least the same or better. So you want to have, so it's easy to get overdosed. When people get overdosed, they can be dependence may cause crimes due to addiction. They may not control themselves because of psychological issues. So people who have addiction or dependence to fentanyl really need medical treatment. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. Fentanyl addiction can be very dangerous. If you have any further questions, please let me know in the comment box below. Thank you. Oxycontin addiction. Oxycontin is an opioid. Some illegal opioids, including heroin, cocaine, illegal non-opioid drugs such as marijuana, methaqualone. Marijuana may be legal for medical treatment in some states. Some prescription opioids, including OxyContin or oxycodone, fentanyl, hydrocodone, codeine, morphine, methadone, and non-opioid methamphetamine stimulant. What is U4? OxyContin is the brand name for the oxycodone. It is extended release, so it can last for 12 hours. It's used to treat a severe pain. How it works? The OxyContin might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. A disease may be an arthritis. For example, arthritis is a disease that might cause a pain symptom, such as pain. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, research Soma before an opioid. Or you should use a low-dose opioid as possible to avoid major addiction from a high dose of the opioid. Drug abuse, it can be from the doctors who inappropriately prescribe. Manufacturers may be responsible for drug abuse if they fail to manage their distribution appropriately. The opioid dependence can be physical or psychological. Addiction means you want to have the same feeling the the opioid give you. The opioid effect or the OxyContin effect, they give you a good feeling like high, so to continue having that feeling. It means addiction. It's easy to get overdosed because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdosed. When people get overdosed, they can be addiction or dependence may cause crimes due to drug dependence addiction. They may not control themselves because of psychological issues. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. To monitor and to decrease the drug addiction, some states have prescription drug monitoring programs to monitor the prescribers, the providers or doctors provide opioid medications. So the best for OxyContin addiction, OxyContin, when it's severe pain, or major injury, you choose the medication as instructed by your doctor. You may check to make sure you don't have this side effect. You may use non-opioid pain relief medication, Tylenol, Motrin, when you have a pain symptom instead of the opioid. If you have any further question, please let me know in the comment box below. Thank you. What is atrial fibrillation or AFib? Atrial fibrillation or AFib treatment duration. What is atrial fibrillation? Atrial fibrillation is when you don't have a regular heartbeat. Sometimes your heart beat too fast, sometimes too slow. That means you may have a blood clot in your heart or in your lung. If you are diagnosed with AFib, then you may be on a platinum medication indefinitely for the rest of your life, unless your cardiologist can convert your heart back to normal. But that's very rare. Sometimes people have AFib, but they don't start the platinum medication yet because they don't have any additional risk factors such as over 75 years old or have high blood pressure, diabetes. Generally, if you have only atrial fibrillation and you do not have any additional risk factors, then you don't have to take the platinum medication yet. They may put you on maybe aspirin. So when you have a AFib, your doctor need to select one of the oral platinum medication. If your AFib is not regular, you may start with the Eliquis, Xarelto, or Badaxa for your convenience. You don't have to do the frequent monitoring tests like warfarin. If your AFib is regular, then you have to take warfarin. So it is depend on what type of your AFib, and your doctor might put you on the best medication. If you have any further question on this, please give me a comment in the comment box below. Thank you. Protein C or protein S deficiency treatment duration. This medical condition is one of the hypercoagulable states. When you have this medical condition, it may cause a blood clot disorder or blood clot risk. If you know the cause of the protein C or protein S deficiency, then you may need a blood thinner medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause, then you may need a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or apixaban, Xarelto, rivaroxaban, Adaxa, dabigatran. Protein C or protein S deficiency treatment duration. If cause of the protein or protein S deficiency, then you may need to take a blood thinner medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or apixaban, Xarelto, rivaroxaban, Adaxa, dabigatran. So for this medication, I think there are ongoing studies. Thrombin or AT deficiency treatment duration. This is the or one of the hypercoagulable states. If you have antithrombin deficiency, but you don't know the cause, you might need to take the blood thinner medication for 6 to 12 months. If you know the cause of the blood clot, and you may need to take a blood thinner medication for 6 to 12 months. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication the rest of your life, especially when you have a blood clot leg or your lung. The best medication for this indication is warfarin. If you have any further questions, please let me know in the comment box below. Thank you. Factor V latent deficiency treatment duration. What is factor V latent deficiency? This is a blood clot disorder. It is one of hypercoagulable states. There are two types of factor V latent deficiency. First one is homozygous factor V latent deficiency. This is my single risk of having blood clot. So if you don't have any blood clot in your leg, your lung, then you may not need to take the blood thinner medication yet. If you do have a blood clot in your leg or your lung history, you might need to take a blood thinner medication such as warfarin for 6 to 12 months. The second type of factor V latent deficiency is heterozygous. It's multiple risks of having blood clot. If you are diagnosed with this type of factor V latent deficiency, you may a blood thinner medication indefinitely, regardless of having a blood clot in the past. The best medication for this indication is warfarin. There are ongoing studies for the other medications such as Alaquid, Geroto, for this indication. If you have any further question, in the below. Thank you. Antiphospholipid antibody syndrome, AAS, or lupus anticoagulant. Treatment duration. Antiphospholipid syndrome or lupus anticoagulant is one of the hypercoagulable states. People have lupus may have the antiphospholipid antibody syndrome. This is the blood clot disorder. So they may have blood clot in their leg. If you have antiphospholipid antibody syndrome or lupus anticoagulant, you may need to take a blood thinner medication indefinitely or for the rest of your life. The blood thinner medication for this medical condition is warfarin or Coumadin. You should avoid taking Alaquid, Geroto, Adaxa. If you have any further question, please let me know in the comment box. Thank you. If you have rheumatic disease, you may need to take a blood thinner medication if you have a history of blood clot. And how long you have to be on blood thinner medication for this medical condition. You may need to take the blood thinner medication for the rest of your life or indefinitely. And the best medication for this condition is warfarin. If you have a history of rheumatic mitral valve disease and you have acute blood clot, such as pulmonary embolism, blood clot in your lung, then you may need to take a blood thinner medication for the rest of your life or indefinitely. And the best medication for it is warfarin. If you have any further question, please let me know in the comment box below. Thank you. Pulmonary embolism or PE. What is pulmonary embolism? Is a blood clot in your lung. So how long you have the medication if you have a blood clot in your lung? Cause a blood clot in your lung or the cause of the blood clot may only need to take a blood thinner medication for about 3 to 6 months. If that you have a blood clot in your lung. Don't know why you have a blood clot in your lung. If that is the first time in your lung, you have to for 6 to 12 months. If you have a second time blood clot in your lung or recurrent blood clot in your lung, then you may need to take a blood thinner medication definitely or for the rest of your life. If you have a blood clot in your leg and blood clot in your lung, so that considered recurrent blood clot, you may need to take a blood thinner medication indefinitely or for the rest of your life as well. If the blood clot is considered at high risk for a recurrence, then you may need to take a blood thinner medication maybe for the rest of your life. And finally, if you have a blood related to an, then you may need to take a blood thinner medication until you have cancer, and at least for 3 to 6 months. So you have to take a blood thinner medication at least for 3 to 6 months, and until you no longer have active cancer. If you have any further question about this, please let me know in the comment box below. Thank you. Deep vein thrombosis or DVT. What is deep vein thrombosis? Deep vein thrombosis is a blood clot in your leg. So, how long you have to be on a blood thinner medication if you have a deep vein thrombosis or blood clot in your leg? A blood thinner medication in about 3 to 6 months if you know the cause of the blood clot. And if that blood clot is the first time in your life. If you don't know what is the cause of the blood clot in your leg, then you might need to take 12 months if that is the first time you have a blood clot in your leg. If you have a second time blood clot or recurrent blood clot in your leg, and a blood thinner medication indefinitely for the rest of your life. If the cause of blood because of an active cancer, then you need to take a blood thinner medication. You no longer have cancer. This is the general information for how long you need to take a blood thinner medication. If you have any further question, please let me know in the box below. Thank you. Well, if you have a mechanical take a blood thinner medication indefinitely for your mechanical mitral heart valve is work. If you have a bioprosthetic mitral heart valve, you might only take blood thinner medication for about 3 months. Then you will be put on aspirin for the rest of your life. General information for how long you have to be on blood thinner medication if you have mitral heart valve. You should follow your cardiologist instructions, including treatment period and duration. If you have any further questions, please let me know in the comment box below. And ischemic attack, TIA, or mini stroke treatment duration. duration, it could be adjustment. So it depends. PHA might need to be aspirin, anticoagulation. So your doctor will determine how long you have to be either on aspirin or warfarin. People prevent PHA. For some people, have to take warfarin to make it safe to make attack TIA or any stroke. Further, let me know. Comment box below. Thank you. Aortic heart valve. If you have mechanical aortic heart valve, you may have to take a platinum medication indefinitely for the rest of your life. The best medication is warfarin. If you have bioprosthetic aortic heart valve or tissue aortic heart valve, then you might need to take a platinum medication for about 3 months, and then you take aspirin for the rest of your life. This is general information for how long you have to take a platinum medication. You have aortic heart valve, your cardiologist will tell you exactly how long you have to be on a platinum medication or an aspirin. If you have any further questions, please let me know in the comment box below. Thank you. Stroke and platinum medication treatment duration. So if you have a stroke and you have to take a platinum medication, you know how long you have to be on a platinum medication. If you know your stroke because of embolic causes such as atrial fibrillation or heart valve, then you have to take a platinum medication indefinitely or for the rest of your life. The best medication for it is warfarin. If it's not because of embolic causes, then you don't have to take a platinum medication, but you may need to take either aspirin or clopidogrel or Plavix indefinitely or for the rest of your life. Your cardiologist will decide what is the best treatment therapy and duration. So you should follow their instruction. If you have any further question, please let me know in the comment box below. Thank you. Dilated cardiomyopathy treatment duration. If dilated cardiomyopathy and you have a history of blood clot or a history of atrial fibrillation, then you may need to take a platinum medication for the rest of your life or indefinitely. If you have dilated cardiomyopathy and left ventricular or LV thrombus, may need to take a platinum medication for at least 3 months. The best medication, the best platinum medication is warfarin. So if you have a history of dilated cardiomyopathy and now you have a blood clot, such as blood clot in your leg or blood clot in your lung, or you have an atrial fibrillation, then you may need a platinum medication indefinitely or for the rest of your life. If you have a history of dilated cardiomyopathy, and now you have a left ventricular thrombus, then you may need to take a platinum medication at least 3 months.